The mechanism behind hiccups. Hiccups occur when there is an involuntary contraction of the diaphragm, the muscle that separates the chest from the abdomen. This contraction is followed by a sudden closure of the vocal cords, producing the characteristic hic sound. While the exact cause is not always clear, it is believed to result from irritation or stimulation of the nerves controlling the diaphragm. Common causes of hiccups. Hiccups can be triggered by a variety of factors, including overeating, consuming carbonated drinks, or eating spicy foods. Emotional stress, excitement, or sudden changes in temperature, like drinking a cold beverage too quickly, can also cause hiccups. In most cases, they are temporary and go away on their own. The role of the phrenic nerve. The phrenic nerve plays a central role in the hiccup reflex. This nerve controls the movement of the diaphragm, and when it is irritated or overstimulated, it can cause the diaphragm to contract involuntarily. This reflex action is what leads to the sudden, sharp inhalation associated with hiccups. Hiccups as a symptom of medical conditions. In rare cases, persistent or severe hiccups may be a symptom of an underlying medical condition. Issues like gastrointestinal disorders, brain injuries, stroke, or infections affecting the brain or nervous system can lead to chronic hiccups. In these cases, it's important to seek medical advice for proper diagnosis and treatment. How breathing techniques help stop hiccups. One of the most common methods to stop hiccups is controlled breathing. Holding your breath for a few seconds or breathing in deeply and exhaling slowly can help reset the diaphragm. This method works by increasing the level of carbon dioxide in the blood, which can interrupt the hiccup reflex and calm the diaphragm. The effect of swallowing on hiccups. Swallowing water or even just swallowing repeatedly can sometimes stop hiccups. This action stimulates the vagus nerve, which can help restore normal breathing patterns and reduce the diaphragm's involuntary contractions. Drinking cold water, in particular, may also shock the system and help stop hiccups more quickly. The use of sugar and other home remedies. Some people find relief from hiccups by consuming a spoonful of sugar, which may stimulate the vagus nerve and interrupt the hiccup cycle. Other home remedies include drinking a glass of water while holding your breath, sucking on ice, or biting on a lemon, all of which work through similar mechanisms to reset the body's reflexes. The role of distraction in stopping hiccups. In some cases, simply distracting yourself can stop hiccups. Focusing on a different activity or engaging in conversation might help calm the nervous system and reduce the reflexive contractions of the diaphragm. This may work by easing the mind and reducing stress, which often exacerbates hiccups. Medical treatments for persistent hiccups. For chronic hiccups that persist for more than 48 hours, medical intervention may be necessary. Doctors may prescribe medications to relax the diaphragm or treat underlying conditions. In extreme cases, procedures such as nerve blocks or stimulation therapy may be used to address persistent hiccups that don't respond to conventional treatments. Preventing hiccups in the future. To prevent hiccups, it's helpful to avoid known triggers like overeating, drinking alcohol, or consuming too many carbonated beverages. Eating slowly, drinking warm fluids, and managing stress can also reduce the chances of experiencing hiccups. However, occasional hiccups are common and usually harmless, resolving on their own without medical intervention.